Good afternoon and welcome to today's session. Today's session is on healthcare IT risks and recommendation as practice to resume operations. I'm here joined by Stacey Gulick today, who's going to be joining me in today's session. Welcome everyone. Hope everyone is doing well. So we're going to get to the very interesting stuff, and I'm sure you guys are really going to be interested in hear a little bit more about security and compliance and some of the things about getting ready for what's coming. Anyway, so once again, for those who don't know me, my name is Nelson Gomes. I'm the New Jersey President and Senior Vice President of Development for Medicus IT, with over 30 years in healthcare IT experience, and one of the founders of the of today's event. So looking forward to seeing everyone virtually. So here's today's program overview. We're talking a little bit about the understanding of the latest security threats, vulnerabilities, and exploits. Those are always fun and interesting. We're also going to look at expanding security policies with best practices, achieving the right balance between security and usability. Okay, and appreciating the importance of taking the zero trust approach. I'm going to talk a little bit about how that's impactful. Making infrastructure and equipment decisions today to succeed for tomorrow, especially during the circumstances during COVID for sure, and strengthening continuity plan and avoiding HIPAA and other regulation missteps. And obviously your questions. Stacey will come in later in the program as I go through the technology piece of it, and Stacey's going to cover some things with regards to HIPAA. So let's start off with security threats and vulnerability and exploits. So we're going to talk a little bit about what are the bad guys thinking and what are the bad guys doing and who are they targeting. I can tell you from experience that more and more, and recently about 2.5 weeks ago, the FBI actually put out a notification through the AP regarding an imminent threat that had targeted healthcare facilities. And within that time frame, as of late, I think 12 hospitals within the, and I think more towards the northeast of the country and out west, got hit by ransomware attacks, and that's going to continue to happen. So I want to share with you some of the tweets that we're seeing actually from these cyber criminals, what we call actors, that are out there. So when COVID came out and started really making an impact, and things were shutting down, telehealth was the big thing, right? Many of you adopted telehealth, obviously, to be able to see patients. And this is what one of them posted, 62 million of Medicare patients who probably don't have an internet or ability to set up Skype, basically keeping elderly out of the hospital system. Oh my God, this is going to be a phishing hacky playground. So they saw the opportunity and they definitely took it. Another report that I want to share here with you here is from the Attorney General, William Barr. And if you look at the second bullet point that talks about phishing emails from entities posing as the World Health Organization or Centers from Disease Control and Prevention, what we saw was actually other emails that were phishing emails that that claimed to be they were from the CDC. And we're going to show some examples of some of those things that we saw. So in this next slide, this shows basically a screenshot from a fraudulent website for for telehealth visits. It looks just like any type of telehealth email that you would get that's inviting you to join a telehealth visit, and it looks just like it, right? And this is one of those things. Hey, just confirm your your appointment confirmation, and this is 100% bogus and is a hack. And what they're trying to do in these types of email, for the most part, is always trying to get your credentials, so your email and your password. And what they do is they take that information, they put it on the dark web for sale. Believe it or not, those type of information has a much longer shelf life than any type of threat. For example, if they take your credit card, you can always cancel it. But with this kind of stuff, it has a much longer shelf life. Another example here is a COVID one that's focused on COVID. And as you can see here, one of the things that we're advising our clients is anything that has a link, even though it says you can see here in the link that says, oh, it's coming from the CDC, where if you hover over it, it really is showing the opposite, right? It's showing down here that that is not the case. So even though they're very clever in masking something that looks just like a legitimate email, it's important to really understand it and takes just a few steps to identify if that link is legit or not. So part of of what you need to do to protect yourself is going to be training and awareness of your staff. And I'll be getting into that a little bit later in the presentation. The next one I want to show you is this, another one from Chase Bank. It has the same look and feel as if it came from Chase. And you know, this had to do with the PPP loan, right? You put in the PPP loan. Now they're saying, hey, we want to verify all your information. We got it. Please respond back. And it might not beat that Chase, but during those times, you never know. So this is a perfect example. Again, another one that was, you know, that had specific targets on folks that were applying for PPP loans, and they were, you know, and they were, one, they were grabbing all their credentials, or two, they had access to their machines and their systems, and put some malware that would, you know, eventually turn into ransomware, which ultimately is something you really don't want to get. That's for sure. Here's one from Amazon. Again, looks just like an Amazon email. One of the things is to look at, if you look at the email address from where it came from, take a look at this. It's really close, and I think that it looks like it's coming from Amazon, but it's not an Amazon email, right? So be vigilant of those types of things. And it may say it, but just click on it, and or hover over it, I'm sorry, and you'll see if that is correct or not. I know. And again, who is it being addressed to? Is it generic? Those are one of the things that they're going to do, is they're going to make a generic email, because they're sending this to thousands upon thousands of people, and all they need is one click. Again, they're looking at, you know, here's, you have a link, and it looks just like that link that it's going to go to Amazon. But if you put your mouse and you hover over it, it reveals that it's not an Amazon website. It's really redirecting somewhere else. So what are some of the policies, you know, and best practices? So one of the things that you can do is really apply for dark web scans, and have talk to your IT partner and understand if they have some kind of a dark web scanning product that they can use in order to scan to see if you have been compromised. What happens is it goes back out to the dark web, and in the next slide I'll show you exactly how it looks, and identifies who within your organization may be compromised. The other good practice to have is dual multi-factor authentication, and some of you have already probably have used it. You know, when you're doing some of your mobile banking, right? When you try to go to your mobile bank, you put in your username and wants to verify that it is you with a token, whether it's it's going to be a text, or whether it calls you, or whether you use a third-party application in order to verify your that you are that person. Encryption. So if you are sending emails back and forth that are sensitive, whether it's PHI or not, obviously if it's PHI, then 100% you should be using some kind of type of encryption. It's important that you definitely do that. But let's talk about other sensitive information, whether it be financial information or other information that's not really related to PHI. Think about using those tools for that. So talk to your IT provider to ensure that they're doing that. As far as we're concerned, is all our clients have encrypted drives already, but on top of that, if they're using third-party email, Office 365 or Gmail, there are encryption tools that you can add to it, so that you ensure that email that you're going to be sending is going to be encrypted. And then I think the best security that you can have is by training your staff. And that has a lot to do with having security policies in place, but as well as awareness and training on a regular basis. Whether you use an LMS system in order to provide any other type of training, whether it's related to HR or not, this should be part of it. This is your biggest weapon against cybercrime, is to really bring awareness to your staff. most of the time when a breach happened, it has to do because that person was not properly trained, or they did it by accident, and that accident could be because they weren't trained properly. So I think the one thing that if you're going to take out of today and has to do with anything with security is train your staff. And here's an example of a dark web scan report, right? And if you see here, it'll show, okay, here's the date that the breach happened, when it was found. Here's the value, and it has the email address of that person. And here's what it outlines. It actually gives you that password. So that tells me that this user account, email, and this password is up for sale on the dark web. That's what that's telling me. And what it does, it also tells you what, how was it breached, and you have the ability with these dark web scan tools to identify that sooner than later. So if it happens, you have a good chance of resetting your password, and that goes away, and now you're back to square one. But not knowing, it could be up to a certain time where your credentials are now compromised, and somebody has that information and they can use that against you. So as far as multi-factor authentication, we talked a little bit about it. Again, it's having that token to confirm who you really are. And there are there are tools out there in this that you can use. Some of them are already part of what your tool set is, right? For example, the banking one could be an example, but you can layer it on top of it, where you can set up, let's say, if for your EHR system, that once you log in, there's integration that you can incorporate for multi-factor authentication. So if you do have it, I would suggest making that phone call to your EHR company and find out if you have that multi-factor authentication capability. If you don't, you should definitely make it a request. I talked a little bit about about zero trust and why is it so important. It has to go with three different focuses. One has to do verifying the user, validating their devices, and intelligently limiting their access on those devices. So verifying the user, we can say that it's a focus on using a multi-factor authentication. Validating the devices is ensuring that when you have that multi-factor and then you are authenticating, that you're authenticating to only devices that you're authorized to use within that network, and then intelligently limit their access from those machines to those devices onto different applications that they're using. For example, EHR systems or your practice management systems. Really understanding and having a thought process behind, if this person is from billing, do they really need access to other areas within the EHR that they really don't need? Same thing with your clinical staff. Do they really need access to the billing side? So understanding that and setting a set of templates so that when you hire someone, whether they're clinical, whether they're on the operation side, understanding what are the access they truly need. Don't give them more, don't give them less, but have an outline and a focus on templating that. And that's why zero trust is so important, how you can bring everything together. Making decisions on infrastructure and equipment. Here's the one thing that, especially with COVID, so infection control is very important, especially for our surgery center friends. Where you're coming in and out of ORs. There is technology out there that are disinfection systems already, where you can actually take them, believe it or not, and put them in a dishwasher. Yes, you can take a keyboard and you can take a mouse, put them in the dishwasher, disinfect them, and use them the same day. And if you don't want to go to that extreme, you can use any type of disinfectant spray on it, spray it, go through the process and disinfect them. You don't have to worry about it. There's specific items like that. One of them that comes to mind is a company called Shield. And if you want to email me for that information, I can send it to you. So same thing with for the cell phones and tablets, they have these screens that you can put on them. They're very easily you can use that disinfectant spray or whatever material that you want to disinfect, but you should have a policy for that, for sure. A good time to consider working on IT projects right now, right? Any of the system upgrades and equipment refreshes. If the second wave comes and there's a probability of having to shut down and come back, think about, well, what do I need now to ensure that if I'm working from home from the last time that I didn't have, that I should take into consideration? You should start thinking about that now. Any other equipment refresh, what are some of the things that you need to consider from working from home that maybe was an issue before, and now that you need to address it, if that second wave comes. Okay, next slide. Trying, folks. Not sure what's going on here. Okay, here we go. Strengthening your business continuity plan. So develop a business impact analysis. Focus on the following things. So here's what we need to focus on: the people, the process, and the technology. Now, as we go through this exercise, you want to understand how it impacts the people, what processes you need to change or upgrade, and what is the technology that you need to put into place in order to address any of the analysis that you find, and especially the gaps. You have to focus on those gaps that you find as you go through this analysis and address how it impacts people, how it impacts the process, and how it impacts the technology. It's going to give you a better picture of what are those things that you need to address. Now, again, it's knowing how to prioritize what you need to start on first, and ultimately what the end goal is. Business continuity goes hand in hand with this business impact analysis, and you want to have that plan in place. It's a live plan. It's something that you should have, not just on from how it impacts technology, but how it impacts your business from the clinical and operational side. Technology is a small piece of it. So what is it that you're going to do in that plan that you need to ensure? If you're working from home, how are people going to connect? Do you have enough licensing to connect? If you're going to go from home, are you going to work from your home computer? Because if you work from home computer, now that might be an issue, because now there's liabilities, and I'm going to leave that to Stacey if she wants to cover that. But now, you're putting your facility at risk if you're connecting from your home computer, unless you have some kind of a remote access VPN. But even with the VPN, you're still connecting to that secure network. Are you using a third party, what they call desktop as a service, or a remote type of desktop that you're working from? So that are things that you definitely need to consider. Disaster recovery, what does your plan look like? Do you have all the tools that you need in that disaster recovery plan? And more importantly, what is your timeline of recovery from your disaster? I always ask everybody, if your server goes down or your systems go down or whatever the case may be, what do? Oh, I have a backup. When is the last time you restored? How long do you know it's going to restore? How do you know what the impact is? Do you know how long it's going to take you to recover? These are all answers that you should know before going into. So think about that. And what I would tell you is revisit them on a regular basis. You should revisit them twice a year. Work with your IT vendor at the same time. Work with your team. This is a collaborative effort between yourself and different department heads. So I always say, for those organizations that are larger, there should be a committee of leadership that's going to prepare and build these plans. Rinse and repeat. It's as simple as that. Let's go through that process of understanding the business continuity plan, disaster recovery, and testing, and you want to continue to do. It's a live thing. It's not kind of set it and forget it. That's for sure. What do you need to be part of your continuity plan? What's your work from home policy? I'm sure Stacey can talk a little bit more about that from a legal and risk perspective. What about your phone system? How are you taking calls? Do you have a voice system where you can automatically just take your calls from your cell phone? Secure connectivity. We talked about those mission critical applications such as your EHR or even Office 365 if you're using email to use multi-factor authentication. What collaboration tools are you using? For example, Microsoft Teams, you have the ability to do video, but it also has the ability to do other things collaboratively outside of video, such as sharing files in one room, such as creating different teams within Microsoft Teams that have separate channels. So there's a lot of things that you can do with different products. Zoom is another product that you can do and use for that type of collaboration. And then I'm going to leave it. If you have any questions, please feel free to send those questions to me directly. Again, my name is Nelson Gomes. I'm the Senior VP of Business Development here at Medicus IT. Feel free to reach out at ngomes@medicusit.com. I can reach at 201-505-1800. I'm at extension 2001. That's all the time that I have right now. I'm going to pass it on to my colleague, Stacey. Stacey, take it away.
Hi, everybody. My name is Stacey Gulick. I'm a lawyer with the law firm of Garfunkel Wild, also co-sponsor of this unique ASC symposium. Nelson, if you want to go to the next slide. I apologize for my tissue. I have a little bit of cold. I promise I don't have COVID. Anyway, to step back a little bit about some points that Nelson had mentioned. As a result of, and I'm focusing a little bit on HIPAA right now. As a result of the corona pandemic, the OCR came out and said, hey, we're going to not enforce if there's HIPAA violations that result from the use of any telehealth technology. So that means that any technology that isn't public facing, meaning somebody else can't just drop into it, so it's not Facebook, you can use in order to provide telehealth services. They also said that they would not enforce against HIPAA violations that may occur in order to have large HIPAA COVID testing sites. And they would allow business associates to report to public health and health oversight agencies for purposes of addressing the coronavirus. Next slide. In addition, they came out with some guidance that said that allowed for the ease of communications with emergency response personnel so that those personnel would be aware that people they're picking up might have coronavirus. And they did allow for a lot more latitude for use of PHI in order to recruit individuals to donate plasma, because the plasma of COVID positive patients has been found to be useful in treatment. So it is not that the OCR waived HIPAA altogether. It was just limited to those waivers of certain types of enforcement and that guidance that definitely eased the rules a tad. So someday that is all going away. So we are going to have to prepare for what we're going to do next. So next slide. We will have to deal with HIPAA as it was once again. What we are seeing is, in fact, that the OCR has been doing more enforcement than ever during the pandemic. This year has been particularly prolific in the enforcement actions we've seen from the OCR. They continue to emphasize the need to encrypt all mobile devices, and especially as we've been working at home, or Nelson had mentioned the importance of doing that. There's increased enforcement about patient access requirements, and I'm going to talk a little bit about that. That is indeed the OCR's #1 priority, is the ability of individuals to access their information. There's continuous focus on the having to terminate the access of individuals when they are no longer employed by or affiliated with the organizations. Again, the OCR is looking at ensuring that entities meet the breach notification requirements, and they frown on entities that do not. There is a huge concern during the pandemic of media access, and I'm going to talk about that in the next slide. I think everybody was a little startled by the vehemence by which the OCR came out against the media access. There's continued mailing on paper, emphasis on paper mailing. So you think after all these years, we've been doing this at least since 2009, we would get paper mailings down, but it seems that we're not perfect with it yet. And of course, there's continued review of the hacking events that lead to breaches, which is mostly associated with phishing. So next slide. So what we've been seeing, what happened during the pandemic, is that a lot of healthcare providers, particularly hospitals, allowed the media into their sites in order to demonstrate to the public, I think particularly in New York and New Jersey, hey, look what's going on here. It's crazy. And the OCR was like, hey, did you get the patient's authorization before you took those pictures? And we don't really care if you like did that thing like this where you wipe out their faces. You were not allowed to allow the media access to those individuals, even if you didn't publish their faces. So the OCR has been meeting literally with every healthcare provider that allowed the media during the pandemic into their facility to find out if they obtained the patient's authorization. Now, this is not new, it's just heightened right now because we had seen a number of other facilities that were heavily penalized as a result of allowing in the media or, to do these reality shows in their facilities. And so the lesson I think we really want to learn from this is that you are not allowed to film or allow anyone else to film a patient until you get an authorization, meaning the authorization has to be before the filming, not before it's aired. It's before the filming. And I actually talked to the regional director in New York region too. And she was emphatic on it. She was kind and nice and understanding of everything everybody was going through. But it is very clear the OCR looks very strictly that you cannot allow any filming crew or media person access to an individual unless they have the authorization first. Okay, next slide. Okay, so let's look at some of the settlements, and I think we want to take some lessons around these because, again, this going forward is really going to color how we are ensuring HIPAA enforcement going forward. First of all, who has to be notified? And I argue with people on this point all day long. So essentially, this company, Centara, they had paid $2.175 million because they failed to notify 577 people when there was a breach. And their argument was that they notified 8 people who they said, well, for those 8 people, the information that was breached included diagnosis and treatment information. But for the other 569, it was just their name and the fact that they were a patient of Sinatra. So that's not a breach. And the OCR came back, and they have been also saying this consistently all along. If it's sufficient information so that somebody looking at whatever information they're looking at would know that that patient is a patient of that entity, it is a breach of HIPAA. So even just to like waylay additional fights with me all the time about that, that is the way the OCR looks at it. Now, if you have limited information exposed, it might be helpful in developing a risk assessment that there wasn't actually a breach not requiring notification, but you still must look at that information as PHI. You cannot just disregard it because there wasn't a diagnosis code or a description of the treatment that was involved. Okay, next slide. All right, failure to terminate. Again, I've been telling this story now for years and years. In this instance, the city of New Haven paid over $200,000. It terminated an employee. That employee, I guess, was annoyed or nosy, I have no idea. Went in 8 days after she had been terminated, stuck her USB thing in the computer, and I can barely turn on a computer, so disregard my use of thing. But stuck her device into the computer, downloaded all the information of 27,000 people, including the results of their sexually transmitted disease status, and gave her password to an intern who used that password all the time. So you would think, and again, I have been saying since 2003, no sharing of passwords, and that really means no sharing of passwords. We need to be reminded that all the time. But more importantly, there is no reason that this woman's access should have been allowed 8 days after the fact. And again, people will argue with me, we cut off the remote access, so there's no way they could get in. Well, obviously, in this situation, the woman walked right into the building and accessed the system. So it is not sufficient to just cut off remote access. When somebody's gone, when they have no longer use of your systems, there should be terminated all of their access for every system that contains PHI. Next slide. All right, this one's kind of a sad story, but one I've heard before, and I want people to think about as they go forward. This doctor practice paid $100,000, and this is what happened. They had an EHR vendor, and I don't know, they didn't pay that vendor for some reason, or the vendor subcontractor. they didn't like what they were doing, they didn't have any money, I don't know, they didn't pay this vendor $50,000. The vendor said, we're not giving you back your information. So the physician's office was like, well, then we are going to report you to the OCR. And the OCR was like, yeah, that's a sad story. However, when we look at you, and you have to remember, when you have a breach, they don't only look at the facts behind the breach. They look at everything you do for HIPAA compliance. And what they said is, you failed to do a risk analysis, you didn't do a risk management plan, you didn't have effective security measures, and you didn't really have a good business associate agreement in place because it didn't safeguard your information. So now you argued about $50,000, we're going to make you pay us $100,000. So once again, you really need to be careful with your vendors, that you, particularly if you have a vendor that is the only copy of your information. So like your EHR vendor, if they have your only copy of your information, you better be sure that you don't just have a basic business associate agreement. You want to put security measures in place to make sure you can get your information back if that relationship goes sour. Next slide. Hackers. All right, they're everywhere. It's really, as Nelson was saying, crazy what's going on. So at this Athens clinic paid $1.5 million. After they were notified by a reporter of all people that said, hey, your information is on the internet. Wow, that really sucks. And so the hacker contacted them, and they have been doing this and said, listen, you need to pay us or we're going to take away your data. And I don't know if they paid the hacker or didn't pay the hacker, but what happened was that the hacker continued to exfiltrate data for like a month, and it ended up that over 200,000 people were impacted, including their social security number. So of course the OCR came in, found again lack of risk analysis, really important thing to have in place, lacked business associate agreements. Over and over, we're hearing the same stories. The funny thing about this is, I just want to mention to you about what hackers are doing a little bit. So originally what hackers would do is they would introduce these ransomware attacks using phishing, meaning they put this malware into an attachment to an email that said like, hey, you click on this to see the status of your delivery of any kind from any source. And you click on it, and then that malware goes and runs around your computer system. And a lot of times what it did was encrypt the total system, so you couldn't get to your information. And the hacker said, all right, pay us $10,000 in Bitcoins. And it's not easy to get Bitcoins. It's not impossible, but it's not easy. So you pay them $10,000 in Bitcoins, and then they give you your information back. So what folks started to do was say, pshaw, we're not paying you. We have a backup, right? So the hackers got smart and said, all right, so sometimes, they're getting around our attacks by having this backup. And if you have like a constant backup, which I think most, at least bigger places do these days, or at least every day, it wasn't a big deal to lose 20 minutes or even a day of information. So what the hackers are doing now, just so you're aware, they're calling and saying, okay, we got into your system and we pulled out X number of data files containing the information of X number of people. If you don't pay us the $10,000 in Bitcoins, we're going to post it on the internet. Yep. So that is the latest and greatest scheme I've been seeing. And in some ways, not always, but in some ways, that attack is worse than tying up your system if you have a good backup, So, all right, next slide. Okay, so Aetna ended up paying $1 million to settle multiple breaches. And I just shake my head at these because we all should be knowing better. So the first one was they transitioned between systems, and then they let a door open, and that's how I think of it. A little robot came in, and that's how I think of it too, as a little teeny robot, came in and took out information of about 5,000 people and indexed it. So that means that if you say you were indexed, you put your name in the system and it would take you to your medical record, which really sucks. And so that was just a simple mistake. They forgot when they transitioned systems to protect something with the login credentials, and the Google bot got in. Then, even more simple, which should not have happened, they sent out a bunch of mailings with the member's name in the window. You know those things where you put the paper in and you can see the address on the window because it's on paper. Well, unfortunately, they made the window too big, and everyone could see those people's HIV status. And then finally, they sent out a research study, and on the outside, they didn't use a window this time, but on the outside of the envelope, it mentioned the type of atrial fibrillation device that the individual was using. So once again, the whole public could see it. So because of these stupid mistakes, and these are truly stupid mistakes, Aetna ended up paying $1 million. Okay, next slide. Okay, now and there's a few things that I think both Nelson and I are going to say over and over again, and it may be a little boring, but I think that it cannot be said often enough. And one of those is encryption is a must when you're dealing with PHI and other types of sensitive information, certainly. But really, from my perspective, when you're dealing with PHI, you really need to have encryption. So the University of Rochester ended up paying $3 million because it lost an unencrypted flash drive and it lost an unencrypted laptop. And actually in 2010, it had lost another flash drive. So what does this mean? First of all, buy freaking encrypted flash drives. Like there shouldn't be PHI ever being put on a flash drive that isn't encrypted. You're just opening yourself. I have handled so many breaches involving someone losing. They're just little things. I lose them all the time. If they got a PHI on it, encrypt it. And that goes again for phones. It's easy to encrypt phones these days, late model iPhones and smartphones of most kinds. You just put a password in and it should be automatically encrypted. If you think of like the whole fight that the FBI had with the iPhone manufacturers about getting in, it's encrypted once the password is on. So just put a password on. Same, you might have to take a few more steps with laptops, but the OCR is not tolerating unencrypted laptops. So I know a lot of people VPN into work and they say, well, I don't have any PHI on your hard drive. Okay, if you don't have PHI on your hard drive, you probably don't have to worry about it as much. But you better be sure there's no PHI on your hard drive. That you don't say, oh, I'm going to download this document because it's easier to work outside that VPN environment or what have you. Well, there you go. Once you get the information on your hard drive, you might forget about it. And it's not encrypted. You lose it. There you go. You have a big breach. So encryption. I'm going to say this again on my next slide. Next slide. Once again, encryption in this one. So Lifespan, which was actually, I believe, the business associate of an ACE, an affiliated covered entity, paid $1.4 million. And again, this was a laptop that wasn't encrypted, had tons of information on it, and there you go. They're paying, $1 million, over almost $1.5 million because they failed to encrypt this laptop. But part of the story was something else I wanted to emphasize. So this Lifespan health system was the parent corporation of a bunch of healthcare providers. So if you think of a bunch of hospitals with a parent corporation on top of them. And part of the reason the OCR was so upset about this story was those entities that lived underneath the parent failed to have a business associate with the parent. And I know we sometimes loosely, non-lawyers, probably particularly not that lawyers are great by any stretch of the imagination, but probably people don't think about it. You think of yourselves as one. But if you're not legally one and you're sharing information, you need to find out a reason you're allowed to do that. And if it's sharing between a covered entity and a non-covered entity, probably the only way you can do that is with a business associate agreement, assuming that the non-covered entity is doing something for a covered entity. So it's just something to keep in mind. Yeah.
I'd love to add something here, if I can, Stacey. One of the things to consider, and you bring up a good point, is, for third parties that are accessing from the outside, ensure that they're using encryption. For example, as an IT vendor, we are accessing our clients' systems on a regular basis, and we're targets. We're huge targets because we have access to your systems.
Yep.
So we have back-end systems when we connect to your machines to troubleshoot whatever we need to do. That connection is encrypted with a high key of encryption. So understand that anybody that's accessing your system from the outside, whether it's BIT, your billing company, who knows where your lab companies, there's labs coming in, ensure and make sure you have it documented that they're doing that as well. So sorry to kind of interrupt, but I thought that'd be a
No,
good,
that's great. It makes it more
quick way
interesting. Thank
to
you.
add.
Yeah, yeah. Okay, next slide. Okay, let's talk a little bit about patient access. As I said, has been the OCRs, and if you don't know what the OCRs, like the HIPAA police, it has been their #1 focus. In the past year, there have been 10 settlements involving covered entities failing to grant patients timely access to the records. And the penalties or the settlements have ranged from $3,500 to $160,000. But the thing about it is, you're like, well, that's not millions of dollars. I get it. But in each one of these settlements were based upon one person's complaint. Just one person was affected by the lack of access, and as a result, there were settlements. So if we go to the next slide, I can go into a little more detail about what we're seeing in those settlements. Okay, so St. Joseph's Medical Center in Arizona, they were the highest. They paid $160,000. In this instance, the mother requested copies of her son's or daughter's information. They provided most of it, but she said, no, there's some things missing. There were like some strips and this, that, and the other thing. I assume she wanted to sue the hospital. So the hospital took 22 months. It required the OCR to get involved in order to get them to provide this mother with all of the information to which she was entitled. And as a result, they paid $160,000. In New York Spine Medicine, this one was $100,000. This person waited over a year to receive copies of her diagnostic films. Now listen, this entity provided the woman with all of her medical records. It wasn't that they ignored her request. They just didn't get her the diagnostic films themselves until the OCR got involved. And as a result, they paid $100,000. Housing Works, King MD, and the other one, can you just go back 1 second? Sorry. Anyway, they all paid, and the thing that was relevant and similar in all of these situations was the OCR got the complaint. They didn't even investigate it. They sent letters to each of these entities and said, please address this and provide the person with their records. Each of these entities completely ignored that request. The patient complained a second time to the OCR, and as a result, you'll see the penalties here. Next slide. So here we have, again, paid $15,000, refused to pay provide the person with a copy of the records after repeated requests. The next one, they refused to provide a daughter with a copy of her father's medical records. And just a little reminder, under HIPAA, a personal representative of a patient is entitled to the records in the same way as the patient. And in New York, if someone is deceased, then it goes to their family members, become their personal representatives if there's no administrator or executor. So you need to treat those personal representatives in the same manner as you would the patient. You can't deny those personal representatives access. And then finally, this Riverside Psychiatric. In that instance, that again, request for records ignored, they said, well, part of those records are psychotherapy notes, so we're not turning over those records at all. Again, the OCR said, no. First of all, if the psychotherapy notes are part of the record, they're not really psychotherapy notes as defined by HIPAA. And moreover, then you should have provided the person with the parts of the record that they could have, instead of completely denying. A little bit, and I don't know if we're going to have time to talk about this, but this all leads into the information blocking rules that are coming down the pike in April. And I think this is the OCR's efforts to really point to people like, no game playing. People are allowed to access their information. And we are focusing on that even more than the breaches we're seeing. So it's really something to keep in mind. Next slide. Okay, so let's talk a little bit about what we can do to address all these things I just talked about. Next slide. Okay, so again, and I know I've been saying this for years, if you guys have heard me speak before, you need to continue to conduct and maintain routine, comprehensive security risk analyses and prepare risk management plans. Because I have seen my share of breaches in which somebody does the security analysis and then that never documents what they did to address the vulnerabilities. You need to document both. For larger entities, I still recommend that outside vendors be used for the risk analysis you know, the more systems you have, the harder the risk analysis becomes. The OCR has been advocating for small to medium-sized entities use of its questionnaire and software. It came out with version 3.2 this year. It's something to take a look at. You still need some IT assistance, I believe, to complete it. It's not intuitive, and you're not going to know the answers without your IT support being involved. But it is maybe if you only have like a EHR and a billing system and don't have a multitude of other systems, it might be something you can consider. But again, you need to have one, however you make that happen. Again, do not allow media access to patients unless the authorization is signed before they connect, before any filming happens. Now that you have more time, and I know everyone was scurrying at the height of COVID to say, hey, I just want any telehealth platform whatsoever. Now let's, you know, we can breathe, we know how to do it. Let's start looking at telehealth platforms that have the appropriate safeguards in place. The number one being that they'll sign a business associate agreement with you. If you have a telehealth platform that will not sign a business associate agreement with you, you need to find a new one. Because again, the OCR is not going to allow this to be lax forever. All right, brush off those patient access policies, both for this and for the information blocking rules. Take a look at them, see what your actual practices are, make sure that you are allowing it. And again, in most of those 10 settlements I talked about before, it was just somebody looking at the request and putting it aside, or going out to dinner, or leaving early. Oh, sorry about my cat. And forgetting to handle it, and you result in thousands or tens of thousands or $100,000 worth of penalties. And you need to remind your staff over and over and over again about phishing attacks and everything that Nelson told you before. You should be sending out email blasts about every new virus you learn about the FBI saying that ransomware attacks are focusing on healthcare providers. These email blasts should go out all the time. Remember, don't click on attachments from people you don't know. If you're questioning an attachment, call. Make sure the person sent it. Hover over the email address to make sure it's real. These are all steps that people need to be reminded about over and over and over again. And I want you to keep a copy of all of those email blasts you do, because honestly, it's almost impossible to completely stop hackers. But if you show that you were educating your staff, reminding them all the time, and the OCR comes knocking at your door, you can say, here, we were really trying, and that goes a long way. That goes a long way with the OCR. So you should really be doing that. Ensure that you're aware of the breach notification requirements. You need to know what the definition of PHI is. And if you're confused about that and you have a breach, particularly a breach involving over 500 people, then you need to involve forensic analysis and lawyers, the bottom line. Make sure encryption is on all your portable devices that contain PHI. And at the end of the day, despite everything that I tell you, you really should purchase cyber liability insurance, because it is impossible to be perfect, and it is super helpful to have that backup if something goes wrong. Okay, next slide. Okay, so I probably am not going to have time, because I see my time is just about up, to talk about the information blocking rules, but I did want to include the slides here for you to review on your own. I want to emphasize that at the last minute, they postponed implementation of the information blocking rules until April. And essentially, the rule is very amorphous and hard to understand, and essentially says you cannot engage in practices that prevent people from accessing information. What the heck does that mean? So we're still struggling, all of us, to completely understand what that means. And again, read through the slides. I give you some examples of what we think that means, but keep an eye out, attend conferences, listen to webinars, get to understand what this means. It is coming around the corner, and it could have huge implications for all healthcare providers and EHR vendors. So thank you so much for joining us today. I hope that you found something helpful in this, and thank you to Nelson. I really appreciate working on this with you. And good luck, stay healthy.
Same here. Thanks everybody for joining us. Don't forget to visit the New York Metro ASC website for where these slides will be available to you. And please don't forget to attend our other sessions throughout the day. Once again, thank you for joining us today, and stay safe.